You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, preventing colon cancer with early detection. With us, we have an expert on the topic, Dr. Blanchet. Dr. Blanchet, welcome to the program.
Well, thanks, Randy. Appreciate being here.
Now, colon cancer. How big of a problem is it, by the way? How many people die from it?
Colon cancer is a bigger problem than we think. Colon cancer is the second leading cause of cancer death in this country.
Really?
There are 150,000 new cases of colon cancer every year. About 55,000 Americans die every year as a consequence of colon cancer. The second leading cause of cancer death among men and women in this country.
Now, we've talked a little bit on the phone, and of those people that die, how many could have been saved with a simple test, like a virtual colonoscopy, in your opinion?
That's really the sad thing. Almost all of them.
Really?
Almost all of them.
So every expert would agree, or most experts would say, yeah, if we caught it early. I mean, is it a slow-growing cancer?
Well, here's the statistics. We can catch colon cancer before it's even cancer. We can find and remove precancerous polyps and prevent them from becoming cancer. We know that if we catch colon cancer stage 1, it has better than 94% cure rate. Unfortunately, almost everyone is caught late. So the overall cure rate in this country is 64% for diagnosed colon cancers. But if we did better screening, we could catch them at that early stage as 94% curable, or maybe we catch them at the stage before they ever become cancers and prevent it from ever happening. We have good data saying that early screening does reduce cancer deaths with colon cancer. So I don't think there's any debate, but this is a cause of death that we can get rid of.
That's
preventable. We can dramatically improve. It's very preventable.
So who is the typical patient? I mean, what kind of patients, and at what age are you supposed to get this done? A screening for colon cancer.
Colon cancer screening, the recommended age across the board for a normal risk individual is age 50. If you have higher risks, then we bring it down to 40 or 45. African Americans, it's recommended to start screening at age 45 because they have a higher risk for colon cancer. And so sometime between age 40 and 50 is usually the screening test, unless you have a family member who had a very early colon cancer. If you have a brother or sister or a parent who developed colon cancer in their 20s or 30s, then you should be screened substantially earlier. But across the board, age 50, unless you have higher risk, in which case we bring it down to 45 or 40.
Okay, now you have a tape that we're gonna show a little bit later, where you're actually flying through. And what's the difference between virtual colonoscopy and standard colonoscopy?
Well, conventional colonoscopy or standard colonoscopy is what we've been doing for the past 5 or 6 years, maybe 10 years, as the primary screening test for colon cancer. And with conventional colonoscopy, we take a 6-foot tube, run it through the entire length of the colon, looking at the mucosa of the colon, and taking out any polyps we see.
Okay.
Virtual colonoscopy, instead of using the tube, we put a very small tube in the rectum, inflate the colon.
Like small, yeah.
Just boop, you're in.
All right.
Inflate the colon with inert gas like carbon dioxide, and then do a low radiation CAT scan through the abdomen and pelvis. So the difference is, with the conventional colonoscopy, it's not a comfortable procedure. We need to put an IV in, put you to sleep, and then you have to have somebody drive you home. With the virtual colonoscopy, there's no need for anesthesia. There's no need for sedation. You can do it while you're wide awake.
So they go in, you say they could walk in, half an hour, they're walking out the door.
It takes a half an hour between walking in and walking out. And I can use myself as a great example.
All right.
I had my virtual colonoscopy at 9 o'clock in the morning. I saw my first patient at 10 o'clock the same morning. You can't exactly do that with conventional colonoscopy.